Good Monday morning at 7:22 right now, and this is Congenital Heart Defect Awareness Week. And for our 7 a.m. producer, it is personal. Her name is Brittany Tavernier. Was born with a very rare defect. In simple terms here, I'm going to explain it to you. Her heart's left atrium had a thin piece of skin which created a third atrial chamber. She had to have emergency open heart surgery as a baby in 1987 at Riley Hospital for Children. Brittany is just fine today, but lots of babies like her are born with serious heart defects. And we want to raise awareness about the issue. And joining me live from downtown right now is Dr. Jyoti Patel, a pediatric cardiologist with Riley Children's Health. Doctor, good morning to you. I skipped the name because I didn't want to mispronounce it. Can you go ahead and tell me what the name of that heart defect is? And then again, it's one of many, right?
Yes, it is. So she had something called cor triatriatum, and it's one of many different types of congenital heart diseases.
What is a heart disease like this, and how many kids are affected? I mean, we're saying that it's rare, but obviously it still affects a lot of children.
Yeah, it's actually fairly prevalent. Congenital heart disease has a big class of lots of different diseases, but it affects about 1 in 100 infants born. That's 40,000 births per year. And the severity really does range from minor diseases requiring occasional follow-up to something like what she had, requiring surgery or intervention early in life.
We love it now with all the technology and specialists like yourself. We're seeing more and more babies who are able to survive, and the rate is going up drastically over the past 2 decades. Is it because of technology, or what is it specifically, do you think, that we're able to, help more children survive?
That's a great question. There are so many factors playing into, from technology to better understanding of congenital heart disease. I think one thing that really makes a difference is this team approach to disease. Here at Riley, we have phenomenal surgeons working with pediatric cardiac anesthesiologists and ICU doctors, cardiologists, neonatologists, not to mention this whole support team of specialized nurses, therapists, social workers, pharmacists, all working together, bringing their own expertise in for the same common goal of the best outcome for a patient. I think that teamwork really does make a huge difference.
Oh, I love that. And I know a lot of times, there are no answers in life. Sometimes we don't know the why, but do you know maybe in some of these cases why certain babies are getting, different heart defects and why?
Yeah, that is a great question, and one that we are all seeking to answer. Right now, for the majority of cases, we don't have an answer for these patients and families. But it is an area of active research where we have researchers here at Indiana University looking to see how hearts are built and how that process is and what genes go into making the heart and heart diseases, to better understand who gets these diseases and why.
Final, we have about 10 seconds. What do you want people to know that are watching this morning?
Just that congenital disease is out there, and that these are some amazing individuals who survived with this disease, and hopefully we'll just keep getting better at treating it in the future.
Doctor, thank you so much. We appreciate your insight this morning. And for those who would like more information, fox59.com/links.